Kia ora koutou everyone, nā mai haere mai. Welcome to today's COVID Q&A session. We are seeing that quite a number of you are logging in at the moment, so we'll just give everyone a minute or two to have a chance to log on before we start our Q&A session.
It's proving popular today. We will be recording it as well.
Should we make a start, Jane?
Yeah, I think so. Numbers seem to have settled.
Cool. Kia ora koutou everyone, my name is Jennifer Andrews. I am one of the education facilitators for IMAG. I work across both the core and COVID team. With us today we have Jane Morfitt, who has just come back from leave. So she has got, I'm sure she's wearing, she's more than happy to steamroll ahead and get the session started. So just a couple of things today for today's hot topic. We will be going through a little bit about the vaccine storage changes. So many of you would have been aware that now we've got an extended time frame for when the community, the Pfizer vaccine, is able to be out of the freezing storage temperature. We will also be talking just really briefly about the new pregnancy advice. This will be updated in the immunisation handbook as well as our online fact sheets through our website as well. And just going to skim over really quickly about the support workers education. Jane will also top us up with a bit of the vaccine timings. What else was it that you were going to?
I think and the ages. I think,
yeah, and the ages of as to who can receive vaccines, because in New Zealand we are our age ranges and the age licensure is a little bit different compared to overseas. So she's going to remind you of that as well. So,
because the point of these sessions as well is for you to ask us questions. So we'll start them off with a few topical things and a few things where we've noticed that there's been errors made or things that have been reported through to 0800 clinical advice where people have had concerns, where the advice maybe hasn't seemed to be as clear as we would like. So we'll start with those bits and then it's over to you and we'll answer as many questions as we can. But the idea is that these are sort of short and sharp and done fairly regularly. So we'll be expecting it to last about half an hour and obviously less if you don't have enough extra questions for us.
Yeah, so there's a Q&A chat bubble that's located at the bottom of your screen. So if you've got any questions, please submit them through there. Now, with recent changes to vaccine storage, so following the approval by MedSafe, the storage conditions have changed for all batches of the COVID-19 Pfizer vaccine that's available in New Zealand, which I'm sure is welcome news for everyone. So the extended expiry means that all the unopened, undiluted vials can be stored up to 31 days, making the options of vaccine outreach and use in smaller clinics easier. So you'll be able to find this information in the New Zealand data sheet as well as on the Pfizer website itself if you haven't had a chance to create an account with them already. Now, with the pregnancy advice, the advice has been updated based on international evidence. So the advice is now that we recommend COVID-19 vaccine in pregnancy. So international data is showing that there are no safety concerns, while the risk of COVID is high in pregnancy. So there are some evidence even that there is antibody protection for babies as well. So much like the Boostrix vaccine. So our fact sheets on immune.org.nz will be updated to reflect this new advice. And this new advice will also be edited in the new version of the COVID-19 chapter of our immunisation handbook this week. Our screening guidance for those who are vaccinating will also be updated to be in line with this advice. Now, as most of you know, that IMAG does provide immunisation education, and there's one thing that's in the works at the moment for support workers. So this is specifically for those who are wanting to work in vaccination centres as a support role. So that could be an observation, that could be at the start in the reception area, and there will be education to help train these people up as well. So the course content consists of Introduction to Immunisation module, as well as 3 other optional modules that includes immunisation conversations, cold chain management, and post-vaccination observation, safety and care. These will be online mostly, unless specific organisations have asked for it to be face-to-face. The eligibility for this course is open to everyone who will be working at vaccination centres and supporting roles. And all the modules that I've listed before are not compulsory, they are all optional. There won't be any formal qualification, but still a certificate will be issued once these courses have been completed. Have you got anything else to add to that, Jane?
No, I think you've covered most of it. As far as the support workers, we're still working with Ministry on this one. There will be some announcements coming out in the near future. But basically, there's 2 levels of training. There's those that, or 2 types of training, those that will be actually sticking the needle into the arm, and the training for those staff that will be having other support roles around the vaccination process. The vaccinators that will be actually sticking the needle into the arm will be working closely with authorised vaccinators who will be doing the screening and the informed consent and the drawing up of the vaccine parts of the process. So there will be lots more information coming out about that in the near future, and we'll probably do a webinar specifically around that. So the other things that I wanted to touch on was some of the concerns that people have at vaccination sites. Should I give the vaccine or shouldn't I give the vaccine? So what we've done is put a new bit on our website on the 26th of May, assessing eligibility for COVID vaccine, just to try and make it really clear. So this in summary says that it's safe to vaccinate people who are pregnant at any stage of pregnancy, as Jen's already said. And also it's safe to have vaccinate people who've had a flu vaccine or an MMR vaccine in the last 14 days. Now, although we're not wanting this to happen, we prefer people to try and plan programs so that you have your 4 weeks after your MMR and you have your 2 weeks after an inactivated vaccine. It doesn't mean that you can't give the vaccine if this hasn't occurred. So when planning, try and plan to have the spaces, because it makes it more difficult to work out if the side effects have been caused by the vaccine, which of the 2 vaccines has caused the side effects. So from getting a really good understanding of the vaccine point of view, then it's much better if we have the spacing between them. But it's not unsafe to give the vaccine. So if somebody's made the effort to turn up to a vaccination site and you find out that they had flu vaccine 10 days ago, 2 days ago, it's fine for them to have the COVID vaccine. People who've had MMR vaccine in the last 4 weeks, same rules apply. Still fine to go ahead and have the COVID vaccine if they've made the effort to get there. If they ring you up and ask, should I come today? And you can rebook them in for 4 weeks' time because they've had an MMR vaccine, that's also great. But if they've turned up and they're there, don't send them away. People with medical conditions or receiving any type of medical treatment. So there are no medical conditions, past or current, or medicines that prevent somebody from getting a COVID-19 vaccination. The vaccine is safe for people with compromised immune systems. However, they may not get the best immunological response from it. And this is why they might be advised by their specialist that it would be better if they'd waited for space up once they completed their chemotherapy or such like. So where we can, we will accommodate them. But if they've turned up at the vaccination site, they haven't been given any particular advice around spacing, then it's safe for them to have the vaccine. The vaccines will still work. It's not dangerous. It just may not be quite as effective as it might have been if they'd spaced it differently. People with a history of anaphylaxis, as long as it wasn't caused by the vaccine or something in the vaccine, will still be okay to be vaccinated, but they do need to have a discussion with the vaccinator around a possible slight increased risk of anaphylaxis, depending on what type of an anaphylactic reaction they've had in the past. And they may well be asked to stay for 30 minutes rather than the normal 20. So all of this is set out clearly on our website. So if you're thinking, oh, I'm not sure about that guidance, it sounds slightly different to what I had been told, please go on our website. We're also in the process of updating the screening tools to make them clearer for you so that you can have that in front of you, printed out with our logos on, with the ministry logo on there, so that you can clearly see that although we would like people to have spacing of 2 weeks or 4 weeks, it's fine to go ahead and give the vaccine. And it's fine again with the patients that are on medications, immunosuppressed patients and such like. You don't need to ring through and ask our advice. We can give it to you straight away. So we'll update the screening tools to reflect that. The other bit is around age limits, as Jen mentioned. We're still getting reports quite regularly, unfortunately, of people under the age of 16 being vaccinated. So we've been asked to please remind you, if there's any chance that the person could be under 16, please ask and check how old are you. And even if they're 16 tomorrow, turn them away, have the vaccine once they're 16 or over. That is what our vaccine's licensed for in New Zealand. Yes, other countries are starting to bring the age limits down. The likelihood is we'll follow suit eventually. But for now, it classes as an error if you give the vaccine sooner than that. Right, and the last thing I was going to cover, if I can just find where I had it on my screen a minute ago, is the MedSafe data. So bear with me. Let's see if I can pull it back up again. If not, I'll come back to it in just a minute. Oh, lost it. Bother. I've got too many different screens open at the moment, which is why I'm looking from one side to the other. So, Jen, do you want to see if we've got some questions? And I will pull the MedSafe data up so I can just give you a quick summary of where we've got to in just a sec.
Yep, I think you'll be more suited to answer the questions that's on here. Would you like to multitask?
I can multitask.
Okay, so when are pharmacies going to be given vaccination?
That depends on where they're located. It will be the DHBs that give them the contracts for giving the vaccines. And so it's going to depend, obviously Auckland's rolling out the programme ahead. Counties Manukau are rolling out the programme ahead of some other regions. But I would imagine it will be in the near future. I would expect most of the bigger pharmacies to have access to it. The fact that the legislation around storage has changed will also make life easier. So that's positive too. So it makes it easier to distribute the vaccine to more sites. When we thought we only had 5 days, the planning was different. So this change in legislation has not long been out. And so the DHBs will be sitting down and going through the offers that they've had for people to give the vaccines and how they can best utilise them.
Cool. And the second question here is, how many cases of severe allergy or anaphylaxis have been reported in New Zealand?
Yeah,
so far?
that's the one. I'm just trying to find the website that I had open a minute ago, because the MedSafe do publish that data on a weekly basis, and I hadn't looked at today's data. I pulled it up on screen and now I've missed it. So bear with me while I try and find it.
Oh, Kimberly has just added it to the.
Oh yes, she has.
To the
Thank
chat.
you.
Yeah.
So if Kimberly's added it, she's added the web link, has she?
Yeah.
Oh, to the chat. My apologies. Got it. Right. There we are. Now we've got it. So as of the 1st of May, the following is published. So if you go on to medsafe.gov.nz, you can pull up the adverse events following COVID vaccine. So far we've had 397. There's no new safety signals this week. 281,005 vaccines have been administered so far. There have been 90 reports of adverse events that were serious. And I'm just looking to see if we've got any allergy ones reported specifically. So of the 366 that were non-serious, 13 of them were reported this week. Of the serious reports, 4 were for allergic reactions. 2 of those were reported as anaphylaxis. And underneath anaphylaxis, it's saying of the 4 reports for allergic reactions this week, 2 where the reporter indicated suspected anaphylaxis. CALM assessed these cases against the Brighton collaboration definition. 1 case was a possible anaphylactic reaction, and 1 case level 2, and 1 case was level 1. I think this basically comes down to the fact that we can get allergic reactions. They're not necessarily full-blown anaphylaxis, but obviously people treat appropriately, call for help, and then it's easy in the hindsight to sit down and go through and work out how serious the anaphylaxis was or wasn't. What they have been saying is that our levels of reactions are similar to other countries, which is reassuring. Right,
cool.
What else have we got?
Any specific cold chain information around using vaccines from 195 dose boxes? So, and is there any time taken off? The 2 hours pre-dilution time, or any time boxes are out of the fridge to check vials or take out vials from the fridge with 195 vials?
There's no difference whether it's 5 vials or 195 vials. So you've still got your 2 hours. They will, of course, the bigger boxes will take longer to defrost, but now you've got your space of up to a month. So I'm slightly confused, Suzanne, as to what you're asking. Are you asking if there's an extension on the 2 hours because they've got a bigger box of vaccines to mix up? Because I would envisage you'd keep the vaccines in the fridge and just take out the vials that you want, pop them on the counter to reach room temperature, dilute them, and then use them. The idea is to use the vaccines as close to them being drawn up as is practical. Although they can be drawn up for 6 hours, it doesn't mean we want them drawn up for 6 hours, because obviously there's no preservative in there. So we want them used as quickly as possible.
Cool. And if people need official COVID vaccine record, how do they access these?
At the moment, it's only via the cards, is my understanding. The ministry are looking at ways of doing a passport or something similar, but I haven't heard any particular progress on that at the moment.
Cool. And there's a question here about the Albany COVID Centre, when it will be opening. I would suggest that you keep an eye out on the NIHCC website or through the COVID19.govt.nz website to see when it is opening, because we don't have the dates for that either. It is DHB led as well, so they'll have more information than we do. There is a question here: how do you handle a patient who refuses to stay the 20 minutes post-vaccination and says that he has an appointment and must leave? So as long as the patient is aware, you know, of how to access help if he or she does end up having suffering from any of the adverse events following immunisations, and that's fine as long as he knows that it is his responsibility if he leaves before the 20-minute observation period is up.
Yeah, I think I absolutely agree with that. I mean, if we know beforehand that they're refusing to stay, we could decline to give them the vaccination, but we can't force anybody to stay. As long as they are aware of the potential risks and you've made a point of documenting. Right, so I've answered that one.
Cool. Just a couple of questions coming through about the support workers course. There'll be more information once it's gone live on our website. So if you are wanting to know more information, I would say in the meantime, sign up to our newsletter on immune.org.nz, and once it becomes available, then you will be notified.
Okay. So there's a question here: is it safe to give first dose of vaccine to somebody who's had a previous anaphylaxis to another vaccine, not the COVID vaccine? And yes, it is, as long as the vaccine that they reacted to didn't share any of the components with the Pfizer vaccine, which would be unlikely because there's very little in a Pfizer vaccine. But what we do know is that people who have had anaphylaxis to injectable medications do have a slightly higher chance of anaphylaxis. So I think they're reckoning it's probably about 4 per million rather than either sort of a normal level of a little bit lower than that. So provided they're aware of that and they're happy to stay, then yes, they certainly can have the COVID vaccine. So if anaphylactic reaction post 30 minutes but slept for 17 hours, should they take another COVID immunisation? There will be a pathway set up within DHBs for people who've had reactions post the 20-minute wait or 30-minute extended wait periods for people to get advice. So if somebody has had a reaction where they slept for 17 hours, that's the sort of thing that needs to be reported through to CALM, and they need to talk to a healthcare professional. And that pathway would be set up as well, so that if the healthcare professional wasn't confident to give them advice, they could discuss it with somebody from the Immunisation Advisory Centre, or healthcare professionals set up specifically to guide people around safety of the second dose of vaccine. But sleeping, feeling extreme lethargy post-vaccination would not be a rationale for it not being safe to give the second dose of vaccine, to answer that question, but also to say that there will be systems in place to answer that type of thing. If you're not sure, make sure you report it and then seek advice. And let the patient know what you've discussed as well, so that they get some feedback and know that it's safe to go and have the vaccine.
Cool. Now, this will probably be a great question to clarify. Jane, is the second dose due on day 21 or after day 21?
It's due from day 21 onwards, but remember the first day is day 0. So if you have day 0 as the first day, and then day 1's the next day, so then you've got 21 days after you've had your vaccine. So there has to be 21 days. So that's why it's fine to have it on the 21st day, but only if you're counting day 1 as 0. And as for the time frame, any time after 21 days or over is fine. And we're not fussed about the timing, whether it was morning or afternoon. But you do need to have your 21 days.
Cool. And just a question, rough percentage of coverage for person 2 weeks after dose 2 is given compared to 2 weeks after dose 1?
2 weeks after dose 2, we're talking around the 95%. And I think off the top of my head, it's around 50%, 55% after dose 1, but I wouldn't want to be quoted on that. I know it's in our training. It's mentioned, but it's certainly nowhere near as good as having both doses. There's somebody here asking about feedback from us about getting their assessment done. So that would be a specific question. If you've not heard back, I suggest you resend the email. It would be COVID-Ed, would it not, Jen, for an email to send through if somebody's struggling to get assessment completed in Auckland?
Yep. So best thing to do really is to go through our website on immune.org.nz or covid.immune.org.nz and find the contact details for your local COVID regional immunisation advisor if you are needing to be observed and signed off, and they will be able to give you a hand with that, or direct you to the right place.
Okay. The classroom, I presume somebody's asking about dropping into the classroom sessions. That will be for the CIR, won't it? Jen, do you know anything about that? Because it's not our training. We just host it on our website, the CIR.
No, unfortunately, I don't know too much about
apologies
that.
on that one. We can't answer that one. But if you go on the question line, the clinical support line that's in the operations guidance, there is an option there to press for CIR support, and I'm sure they'll be able to help you on there. Right. Somebody's asked if we could speak on the positioning of vaccination sites. Now that's a good opportunity for me to promote the new fact sheet that came out about 2 weeks ago on vaccine administration that's on our website. That covers very clearly the landmarking that you should be doing to make sure you get your vaccination correctly positioned. We are still seeing far too many vaccinations too high up. And I think some people are using old skills, old techniques. And the technique that we are using currently is to actually feel the acromion process, so the bony bit at the top of the arm, feel down to the end of the deltoid muscle, and then midway between those 2 points, usually in line with the axilla, is where you should be giving the vaccine, which actually ends up quite a bit lower than some people are vaccinating currently. And if you watch on the telly, I cringe at regular intervals when I watch people administering vaccines incorrectly, not just in New Zealand, I hasten to add. We have had some really good examples on TV in New Zealand, but please make sure you're not too high. If you've any doubts, have a look at our fact sheet. It also covers when to use a longer needle for people with larger arms, and various other practical bits as well. Plus, Jen, I'm just thinking we might need to update the cold chain on that one.
Yeah, no, that's all good.
Make a note to that effect. Right.
There's a question here about giving whether or not a person is able to receive their second dose of COVID vaccine early because they're travelling overseas. The answer is yes, on a case-by-case basis, we are able to vaccinate earlier, but please do phone the 0800 immune phone line to ask for advice, or phone your COVID regional immunisation advisor for advice.
Yeah, it's on an exception basis, and the vaccine protectiveness may not be as good, but obviously if you are going to somewhere like India, as was mentioned in this particular question, then we have to weigh that up against the benefits of having that second dose of vaccine and how long a spacing it was. So although we say, please make sure you get your 21 days between doses when you're giving the vaccine, there can be an exception occasionally if there's a really good reason, and travel basically is about the only really good reason, and they'd have to have a good reason for needing to travel as well. So ring through to our clinical support or talk to one of our team if you have got an exception, and then document why you've made the exception. Right, I've done that one. There are the safety concern in giving a vaccine too early is that it may not be effective, and therefore you get more chance of ending up getting COVID. So from that point of view, we're very keen to keep our spacings right. We're also not in a situation where there's a real rush to get second doses of vaccine given. So just because it's more convenient to have it done 2 days earlier or such like, we'd rather people waited longer and had at least the 21 days. So if in doubt, longer is better than too short. But no, it's not dangerous as such. It just may not be as effective.
Cool. I think we can take one final question here. It's cold chain related as well, Jane. So if vaccine vial expired at 10 a.m, if you take out the vaccine from fridge and dilute it and mix it at 9:30, after mix up, the new expired time now becomes 6 hours after 9:30, which is 3:30. Is that right?
Absolutely. That says we don't want them sat around till 3:30. We would like them used as soon as practical after you've diluted them. And now we've got that longer 30 days, we shouldn't get down to the wire like that. We shouldn't need to be down to the wire like that. So really do try and manage your stock so that you can get it used. But if you do notice you've got one that's just coming up to expiry time, yes, get it out the fridge, get it diluted, and then you can use it first in your vaccination session. Right. Well, we've had quite a few questions today, haven't we?
Yeah, we do. And just one last question here, I think, before we wrap up. Can visitors, are they allowed to have vaccine in New Zealand as they don't have an NHI number? Yes. So if there's any visitors in New Zealand who are wanting the COVID vaccine and they haven't been vaccinated, then yes, absolutely, offer it to them. They are eligible and it will be free for them as well. As for the NHI number, I believe that you can get an NHI number when they're first entering them into CIR. Is that correct, Jane?
My understanding is yes, you can, but I'm not an expert on CIR, so I hesitate on that one. There's another quick question that's come up. There's a really good one here, actually asking about a reflection form for this webinar. We are putting, I don't know, Kim, are you listening? Have we put the reflection form for webinars on our website yet? Because I know before I went on holiday a week ago, we were designing one so that if you listen to a webinar, you can then do a reflection. So you can fill in the front page to say that you'd listened to a Q&A webinar or one that's specific topic related, like we did one on pregnancy just before I went on holiday. You can then reflect, what have I learned from it? What am I going to do about it? And then it becomes part of your professional development portfolio, particularly for nursing staff. If it's not already on our website, it will be going on our website in the very near future. If you want to give us just general feedback about things that you liked or things that you didn't think worked very well with this format, please again send any comments through to covided@auckland.ac.nz, and we'd be very happy to hear your comments. We're trying to balance some general Q&As, topical catch-ups, alongside the webinars that are very topic specific. So like we know, there'll be a support worker specific webinar in the near future once we've got all the regulation side sorted with the ministry and everybody's really clear on the roles and responsibilities and such like. So we're just working with the partnership of the ministry on that one, and then we'll be doing that. So if you've got any other ideas or suggestions, please send them through.
Cool. In the meantime,
Right.
let's wrap up this webinar. Then, are you happy to do that, Jane?
Yes, that's fine.
Cool. So thank you everyone for joining us today. We hope it's been informative and that we have tried answering your questions as best as we can. But please remember there is still a wealth of information on our main IMAC website, immune.org.nz, as well as covid.immune.org.nz for COVID specific information. There are plenty of fact sheets out there to help support your work that you are doing out there in the community, whether you're working in a GP practice or whether you're working at a vaccine centre. And please do remember that we do have an 0800 phone line that you can utilise and phone if you do have any clinical queries.
Right, and when's the next one of these? I thought we were doing them on a 2-weekly basis, but they will be advertised on our website. I think it depends on how many topic specific ones, just what's come up that's particularly topical, that we'll be doing those, and then in between times we'll be filling them in with these. So if people find them helpful, that's good to hear. Thank you.
Cool. Thank you, everyone.
Cheers then. Bye-bye.